Good morning. This is Kristen Howell, the CEO of the Children's Advocacy Center for Denton County. I wanted to give everyone an update about how the Advocacy Center is responding to child abuse in the time of COVID-19. There is not a day that's gone by that our staff hasn't worried about how to respond better, and not a day that has gone by where the sense of urgency has decreased. Because the truth is, child abuse claims, overall reports are down, but severe child abuse cases have increased. We're also getting reports at the national level that cyber tip lines have exploded through the roof with increased volume. The number of kids who are being sexually exploited online is truly record-breaking at levels that we could not have ever believed prior to this epidemic. So what is Denton County's response for that? Well, I'll tell you that we have, we originally pulled our staff off-site in compliance with our countywide restrictions and the CDC guidelines, and then created an on-call response. But as it turns out, our volume has been high enough to warrant having both offices open and continued services. So trying to balance that safety of our staff and safety of the community with safety of kids has been a real challenge for us. And so what we're trying to do right now is implement, and today is the first day of full-on implementation of it, is continuing to coordinate every single case that comes into the county when it comes in. So not having any wait list or any delay in the coordination, but then creating a virtual platform for forensic interviews. Those are the interviews that allow us to get the child's statement about what has happened to them, if a crime has occurred, and if so, where and when and who did it. Those forensic interviews are been sort of the sacred component of the Children's Advocacy Center model. But it is now really important that we do that in a virtual way. And so we're doing that on site still, but having interviewer and child in different rooms when symptoms or when screening questions require that. So that has been an important shift for us, and kind of an all hands on deck as we train throughout the state and the region on how to best do that. And then work with our prosecuting teams on how to make that be something that will hold up in court in a few years, because that's what we're always thinking about, is if there is a prosecution later, how do we get to that point successfully for the child? How do we ensure that there are no barriers to justice? So that remains our priority today, even during this epidemic. One exciting thing that has happened is we've been able to move to a total switch in our mental health teams to a telehealth platform. We've invested in some HIPAA compliant teleplatforms and are really, really pleased with our ability for families to be able to get access to mental health services. We've signed up hundreds of our clients, and they are actively working on long-term mental health trauma therapy right now as we speak. And so we've been really, really pleased at our team's ability to jump in on that and our family's ability to make it happen. So that has been a really exciting thing. We continue to do medical exams both on site and in hospitals when it allows. In short, I would say I want people to know that our direct response for child abuse is as robust as it has ever been. But we're also doing some additional services. We're working with our education team has been really creative on trying to figure out ways to connect with parents who may be at the end of their rope. So families who are potentially needing some prevention work. We've been able to create an online parent cafe, which is a place that parents can go and get support and be around other parents just for a break. So that has been a really exciting avenue for us, and we've been really pleased at the results. It is truly a remarkable way to connect with at-risk families and families who are stressed and isolated, which, as it turns out, is a whole lot of families right now. So that has been a real effort. You know, one of our biggest concerns has been that our boots on the ground, our eyes and ears on the ground, folks who are who have access to kids are our teachers. Teachers are in great relationships with kids every day across the region, and they are who kids confide in about abuse going on in their home. And so our teachers have been sidelined right now, and that has been an enormous worry for us. We're so excited to see more and more teachers connecting with their students via online platforms, and we're working with schools on how to begin to have meaningful conversations via this platform, so that kids can continue that trusted relationship and share information with teachers if they don't feel safe in their home. So having teachers learn how to engage in that and get information so that they can make additional reports is going to be a really important step for us. All in all, the Advocacy Center continues to respond and react to every single crime of child abuse that's reported in the county. It's critical for us to do it. All of us are truly laying awake at night, scratching our heads, trying to figure out how we can ensure that those kids who are at risk right now have a forum for safety, a forum for healing, and a forum for justice. And we never want to slow down on that effort. The truth is, though, that we're also very concerned about the funding for all of this. We today got notification that our payroll protection loan was approved, and so we were able to get payroll funded for the next 2 months, a Herculean effort by our bank and our team here at the Advocacy Center, our board of directors. So we're thrilled with that. It allows us some peace of mind as we go forward. But there's an awful lot of additional operational costs that have got to be funded. And so we've had a donor step up in that way that only some just sort of God-driven donors do. I'm stunned by generosity and the ability to support an effort as big as this. We had a donor who came in and said that their family would give a $175,000 match for anybody who would donate to us during this time. And so that is so critical. That's open through North Texas Giving Day, which has been rescheduled into May. So any donation between now and May 5th will be matched through that $175,000 donation. And so we are so thrilled with that. Going to our website is probably the best way, CACDC.org/donate is how you would make a donation online, and we hope that you'll continue to support this effort. Know that we will continue to support children in our community, and that there won't be a day that goes by that we don't believe in that cause and work toward that mission. So thank you so much for tuning in today. It is quieter here at the Advocacy Center. And not how we anticipated spending our spring in our new building, but we are honored to be able to be designated as an essential employee and honored to be able to serve kids in the community this way. So thank you very much.